Hi friends, I am Dr. Pratap Singh. I have done MD in forensic medicine, and today we will start with introduction to forensic psychiatry. Psychiatry as a subject is deals with the study, diagnosis, and treatment of any mental illness. So it is a branch of science medicine which deals with the study of mental illness, diagnosis, and treatment of mental illness. When this knowledge is applied in administration of justice, then it is called as a forensic psychiatry. Forensic psychiatry deals with the application of psychiatry in administration of justice. So anything related to uh, law which is related to mental illness is considered as comes under as forensic psychiatry. Mental illness or soundness of mind can be defined as a disease of mind or the personality in which there is a derangement of mental or emotional process or impairment of behavior control. So, in a broad term, any mental illness or unsoundness of mind is term which is used to any person who is mentally ill is considered as a disease of a mind or a personality, means person may have some disease or person may have developed some kind of personality himself in which there is a derangement of mental or emotional process. The person is unable to mentally and emotionally cannot process the surroundings which is or control his behavior that leads to mental illness. Here the intelligence may be weakened or perverted, but the mentally ill person may not be show physical weakness. So the person may be mentally ill, may not be physically weak. Law is most frequently concerned with mental ailment and not mental illness. So whenever there is anything which related to mental illness or anything considered as unlawful, the law is mainly consider is look after is mental impairment in the sense that they look how much degree the person is unable to how much part of the body's mind is able to understand what he is doing, so how much he has understood the crime he has committed, or how much impaired his mental part is impaired, so that he is unable to understand what he is doing. That's the part which law is concerned. Law doesn't concern whether what type of disease he is suffering from. They just want to know what type of impairment he has, which from which because of which he is unable to understand the law and he may commit an act. There is different kinds of degree of mental ailments are present for different legal issues. So there are different types of symptoms, signs, and diseases are present. Different degrees are present, which the law looks after. So forensic psychiatry comes where there is different responsibility of a person, like responsibility for crimes, sexual psychopathy, competency to contact, like any type of contract, maybe marriage contract or legal documents, competency to testify, to give evidence, ability to give informed consent to treatment, ability to consent any form of medical issues, competency to stand trial, testimony capacities, capacity of the person to give to write a will or case of malingering. So in all cases, fire secretary comes where it look after the person's responsibility towards those. uh, Now coming to some common symptoms, some common psychiatric terminologies and symptoms which depict the symptoms of mental illness. These are certain terminologies which comes across related to forensic psychiatry. First of all is the affect. So it means outward manifestation of person's feelings, emotions, tone, or mood. So affect means the person's how we can express his feelings or emotions or tone or mood. Abrication, it is reviving or bringing into consciousness when the person who is unable to or the person who is lost conscious or is not in his conscious state, if he is revived or bringing up like forgotten or the traumatic experience which is brought up, that is considered as abrication. Aphasia, this is condition, it is loss of ability to express meaning by use of speech or writing, that is called mode of aphasia, or to understand spoken or written language. So here in this condition the person is unable to express his feeling by in form of he is unable to express in form of speech, or he is unable to write, or he cannot understand, or he cannot listen also. So here in written language, that is considered as a aphasia. In cognition, this refers to higher mental functions like cognized person means his higher functions like his memory, his intelligence towards any subject, his concentration, orientation, that is all considered as cognition. Then coming to confabulation, it means pure imaginary events or fabrication that fills the gap of pathological loss of memory. It means that the person fills the gaps in the memory with any imaginary events so that he feels that memory is intact. Though he may not remember anything, he fills those gaps in the memory because of illness with imaginary events. Then affective disorder. This is a psychiatric disorder in which the chief feature is relatively prolonged affective change of abnormal degree. Like in depression or mania, the person has certain form of affective change in his degree that persists throughout. Then coming to delirium, this is one form of condition where there is a confusional state. This is it is a form of condition where the person is in confusional state. So in the sense that he may not know what is surrounding is present, what is happening in throughout this. So he's in a confused state that is considered as delirium. This is one form of common symptom which is seen with the drug abuse and withdrawal from the drugs. Also, it's seen in delusion. So it is defined as false but firm belief in something that is not a fact and which persists even when the falsity is proved. So it is something in a false thing which the person believes even though it is not false. So there are very different types of delusions we discuss in videos. For example, if the delusion of persecution where the person believes uh, firmly that someone or some relatives are trying to kill him, and in that way he may try to protect himself and may kill other relatives also. This delusion. Then disorientation, that is disorientation is impairment of understanding of temporal, spatial, or personal relationship. So the person is not oriented to what wherever he is present. So he may not understand what is the time, what is the place. In a place of place, he doesn't know in the hospital or he doesn't know where he is present, or he doesn't know what time is today's like that. Disoriented person. Then fugue. It is defined as state of disturbed consciousness with which a patient performs some acts. Though he or she looks apparently normal while doing the act, on recovery he has no recollection of events. This is a state of consciousness where he does certain acts without any memory and loses thought memory, but he doesn't recollect of the event. So that is a condition, disturbed consciousness, where he may do some acts, cannot remember that act. Next is hallucination. This is also one of the important symptom. Here, this is defined as fast perception without any sensory stimulus. So here the body senses perceive the senses, but there are not any stimulus is present. Like for example, there may be visual hallucination where the person sees some object or something which is not present, without anything. Like in a thin air, he may see some birds flying like that. That is the hallucination. Then there is illusion. So illusion is false interpretation of any external object. Here the person interprets some object as different object. Like example, he may mistake a stick for a snake. He may mistake a curtain for that person. He may be standing like that. It's one form of illusion where the falsely interprets the external object or stimulus which has a real existence of home. So he may see a dog or a cat has a tiger, like the false interpretation of that stimulus. Then insight is awareness of one's own mental condition, characterized by significant basic changes in the future behavior personality. So here the person own uh, understands his own mental condition and may sometimes approach a doctor that he is suffering from certain then intelligent quotient or IQ for short is the means intelligent capacity of an individual in relation to his chronological age. This is usually tested for mental capacity of a person. They test the intelligent capacity of a person to its chronological age, how much it is present, that is IQ level. Then lucid interval. This is defined as a period in which mental illness there is complete cessation of symptoms of insanity and person is considered perfectly normal mentally. So here it is a period between a period of mental illness where the person is completely free of any mental illness. That is a lucid interval. Lucid interval is nothing but period of symptomless period between the period of symptoms, like in conditional lucid interval. Then coming to mood is a pervasive emotion or feeling which is sustained. So he has some a form of emotion that is present and feeling which is persistent mood of a person. Then neurosis, it is an emotional disorder in which the patient does not lose touch with the reality. Neurosis is a condition where the person, though he may have certain experience of certain mental illness, but he knows what is going on with his world, what is where he is present, that he doesn't lose the touch with the reality. Then obsession, here the person will have symptoms of a single idea, thought, or emotion. So he has certain idea, thought, and emotion entered constantly and continuously, which persist in spite of recognizing it as irrational and all efforts being made to drive it from the mind. So here the person gets an idea. For example, he gets the idea that a door in his the outdoor is not locked, and that idea thinks that thought is kept in his mind, and because of that thought he's completely getting depressed that that door is not locked, and he will feel that someone may come inside house. So and for that emotion he constantly goes to the door and checks whether the door is locked or not, comes back to sleep again, and again he has idea that the door is not properly locked. This is constantly present, continuously persist in spite of recognizing it as irrational. Though he knows that the door is already locked, which is irrational, but that is kept persist and it drive it present in his mind. As then panic, it is an acute, intense, swelling episode of anxiety. So here the person suddenly have a increase in anxiety associated with certain feelings. Maybe panic attack for any event or any situation. It may be. And phobia, it is excessive or irrational fear of an object, situation, activities. A person is excessively fear of an object or some situation. That is in psychosis. It is a mental disorder which severe and characterized by withdrawal from reality and living as if in another world of fantasy with delusion and hallucination. Psychosis is a condition where the person is already loses touch with the reality. He feels that he is not living in he's living in another world with certain delusions and hallucinations. He sees certain objects, he hears some objects, he feels something which is not which is false and continuously repeating. Super is a state in which there is akiness, that is no movement or mutism, where he doesn't talk, with complete separation of speech, movement, and action with no disturbance of consciousness. Though person is conscious, the consciousness is not disturbed, person is unable to move, unable to talk, or unable to do any activity. Super. Trance is a state of altered consciousness, often with absence of voluntary movement or automation, as in the hypnotism or epilepsy. So this is condition where the person, uh, though conscious, is altered conscious state with absence of any movement. Person is not moving, but his consciousness is altered. Twilight state. It is a state in a state of diminished awareness of act of relatively short duration. The act performed during the state leaves little or no subsequent memory. Commonly seen in hysteria and epilepsy. So this is a state where the person's awareness loses for short duration, and he may perform certain acts with little to no subsequent memory of that act. Then under the influence is defined as physical, mental pressure of such degree that person is deprived of his or her privilege to exercise his free will. So this may be related to certain drugs or certain any mental illness where he has physical and mental pressure to such a degree that he cannot exercise his own free will because of certain drugs or certain illness. He may not be able to exercise his will, that is considered as under the influence. These are a few common terminologies which are used in mental illness, and among them few we'll discuss in future. Some references.